What's up, YouTube? It's your boy, Mr. Elisha26, back at y'all again. I'm 1 week and 1 day post-op. Yesterday was my official 1 week, but I was still kind of jet lagged, so kind of wasn't in the best mood to make a video. Today I will show you my chest. At this point in the healing process, there's a few things going on. Some stuff that's in pretty much everybody's videos, and one thing that I haven't seen in anybody's videos, so I feel it's very important to kind of discuss it because it freaked me the fuck out, and I had to call Dr. Garramone to figure out what the hell was going on. So I guess I'll just show you my chest now. So this is my chest, 1 week and 1 day post-op with Dr. Charles Garramone down in Davie, Florida. So what you're looking at right now is me fresh out of the shower. After you take your shower, you're supposed to pat dry with a clean towel and then let the rest air dry for a bit. So I thought I'd make a video. So this here is my right nipple, and as you can see, I'll bring this around a little bit. As you can see, the color is starting to turn pink a bit, and we're starting to get some of the scab falling off a bit. This one is really good. There was a little bit of blood in the bandages when I changed them yesterday. And then we're going to go over here. This is my left nipple. And as you can see right there, there is a section, a little area where there's quite a bit of white meat showing. And that was what freaked me out. And that's what I'm going to be discussing a lot about in this video. Because I haven't seen that in other people's videos. And I feel like maybe some other people might have experienced this who don't make YouTube videos, or who aren't, or who didn't discuss it in their videos. So essentially what happened was I ended up, that little bit of white meat was actually there from break when I first had my reveal. So Dr. Garramone saw it during the reveal, and if you watch the video, he didn't really mention it. So I saw it a little bit from the reveal, but when I'm looking at it like this, from a laid down position, I couldn't tell exactly how much was showing and what exactly was going on. So as you know, at the reveal, he puts the zero form on, then he puts the bandages on, so that was the only time I got to see my chest. So yesterday, when it came time to take my shower, my mom came down to my room and she helped me out of my ace wrap, and then she helped me peel the tape off. And when we got to the zero form, I was able to get the zero form off of this nipple, but not this one. I had to take it off in the shower. But when we peeled it back, we saw that white meat at the bottom, which freaked me the fuck out because I just didn't know what that was. I remembered kind of seeing it, but not seeing it very clearly. And here I was at a mirror, able to see it very clearly. So I was kind of freaked out. So I went and took my shower, and just like let the water run over my shoulders, down on my chest and everything. Got out, patted dry. Came back downstairs, was looking at it some more with like a handheld mirror, like really close, so I could see what was going on. And I was kind of freaked out about it. I talked to the two other guys that I was at New Beginnings. I'll tell you about that a little in my next video. That I was at New Beginnings with, and they were like, you know, one guy was like, I'm sure it's fine, because I sent him a picture. He was like, it just looks like, you know, you lost the little bit of skin and the coloring. It shouldn't be a big deal. And then the other guy was like, call Dr. Garramone. And I had forgot that you could just call him and go straight to his cell phone if you feel like this is an emergency. And it was a little blood coming out of that area, so I kind of felt like it was kind of like an emergency. Like, I need to know, do I need to go to the doctor? What's up? And so when I got him on the phone, of course, because I had just had my post-op the day before, he remembered me and remembered what was going on. And basically he said what happens in quite a few cases. He said it's not very common, but it's not uncommon. It happens a lot more often than you would think. And so he said what happens is when they sew the little pillow cushions on top of the nipples, and then they put the larger dressing on, and then the ace wrap. Sometimes from the pressure and then from us moving around with the ace wrap on, you get a small blister right here on the skin surrounding your areola, which then later the blister kind of pops and the skin peels away. He said that's pretty common. So then what ends up happening is you end up getting a little spot where the top layer of skin is peeled back. He says the suture goes deeper than just the top layer of skin, so there's no fear of this nipple rejecting or anything like that. But I just hadn't seen anybody discuss that in their videos, and so I thought it was pretty important that I get this video out as quickly as I could to show you guys what what I'm going through, and so then we can have kind of like a baseline and document how it starts to heal and whatnot. Besides that one little issue, I haven't had any freak moments about my nipples or anything like that. I haven't had any, like, oh my god. I was very nervous to take that first shower. Even with the water coming over the top of my shoulders and running down, I was like, is this too much pressure and everything? So yeah, I still kind of have some tape residue. A little bit right here and stuff. That is it's going away slowly but surely every shower. But I'm kind of like scared to like really scrub at it and get in too vigorous because I'm afraid the washcloth might hit my nipples. I don't want to damage them. You know, my drain wound on this side is like right here, but on this side I'm not sure where it's at. I can't even find it. It's already pretty much closed up on this right side. It's healing really fast. Besides that, the tape has just started to peel back on this right side right here. The left side is still pretty much a fix, so I'm checking that to make sure it still looks good. Numbness in my chest is like, all of this is numb. Like, I can feel the pressure, but I can't really feel. And then around here, I don't even really feel the pressure at all. I just know that I'm touching it on the left and the right. Little feeling right here on the right though. So, not in any pain. Very itchy though once I get like the ace wrap and stuff on, and I think that's just my mind. Like, you can't scratch. I know healing itches, but like right now it's lightly itching. But when I know when I put the ace wrap on, it's gonna itch like crazy. So I guess the itching is a good thing. Right about here on my skin, I have a few little scabs from the tape, but nothing too serious. And then yeah, that's the only area where I have any like, I guess, tape burns is what people call them. Besides that, I'm very happy with my chest. I like the way it looks. It's really flat. I'll show you sideways so you guys can see. Yeah, I got a little bird chest. It's still kind of weird to stand up straight just because I can feel kind of like a pull going on. So stand up straight is kind of uncomfortable a little bit. I'm working on that because the pull is not uncomfortable. It's just I'm very subconscious. I don't want to, mess anything up. So I'm working on my posture a bit more, but I do kind of feel like, kind of scared to stand up fully straight. Yeah, I got a little bird chest, even with the push-ups, but I wasn't expecting that to be anything hella freaking significant. So February, I'm definitely going to be hitting the gym. Besides that, I don't have any complaints. I haven't had any other freak out moments. I can already see that it's starting to heal a bit better than it was just yesterday. It looks a little bit better. And so I've been putting the Zero Form and the antibiotic ointment on it. every day. That's what I'm about to do after this. Also, another thing, if you are if you're gonna have top surgery, you should get one of these, a long-handled scrub brush. These are great for getting your back when you're in the shower. So a good friend of mine, Tiana, got this for me, and I really appreciate her doing that because, yeah, it saved me in the clutch. It's definitely difficult to wash your back in the shower after you've had top surgery, and this makes it a whole heck of a lot easier. Besides that, I appreciate all you guys' comments, all of your support, all the thumbs up that some of you guys have been giving my videos and everything. If you have any questions about my chest, more specifically, get the light, more specifically, this little kind of blister right there, please let me know. You can put the comments down. You can put it in the comments, or you can email me, or what have you, and I'll be sure to get back to you. And then, you'll watch it heal just like I will. So, yeah. I think that's it. So until next time, much love and much light.